questions, I think, on those points that you've just raised specifically. I'm going to come now to Simon Fell.
Thank you, Chair, and thank you very much for joining us. Mr Rodhouse, if I start with you first. When Dame Carol Black did her review on drugs policy, she stated that she wasn't certain that if law enforcement agencies were sufficiently resourced, it would result in a sustained reduction in the supply of drugs. Even in that set of circumstances. Would you agree with that assessment?
Sorry, I'm not sure I've understood the question. I want to get that right. So
she said that if law enforcement agencies were sufficiently resourced, even that might not result in a reduction in supply. Would you agree with that?
So it's a really complicated picture. I don't disagree, but I think there's nuance to this. So I think it's very relevant that last year UK law enforcement, driven by the National Crime Agency largely, seized 284 tonnes of cocaine, so more than double what is consumed within the UK. And yet it's fair to say that availability within the UK persists. So I'm not claiming that UK law enforcement alone can stem the flow of drugs into the UK. As has been said earlier, the demand is there. What I do say, though, is that our work is not wasted, because I think unless you continue to target, both at home and abroad, source countries, transit countries, the highest harm groups within the UK, that situation would become much worse, and the UK would be flooded with drugs to a degree that it would cause more harm within our communities. So it's absolutely right to say that law enforcement alone, no matter how well-resourced, can't solve this problem, because it's about demand and treatment and education as much as law enforcement. Law enforcement has a very, very important role to play. And as I say, from the National Crime Agency perspective, that is abroad, it's closer to our borders, and it's within the UK. I could always use more resources, though, for the avoidance of doubt.
If only it was mine to offer. So you lead me neatly onto my next question. So this isn't just a law enforcement issue. Absolutely. This is about the whole system approach. Is what's going on at the moment effective? Is it working?
Well, I think where I sit, we lead the UK's fight to cut serious and organised crime. We are a 24/7 law enforcement organisation, and we work on a national and international level. So I'm not best placed to talk about what is going on in our communities in terms of treatment and education. That's not my area of expertise. I do know I've been in law enforcement for 29 years now, and I have run projects that focus on volume criminals who are offending because of their drug habit, and I know that the threat of law enforcement action alone is not the tool that will cause them to cease. It is treatment, it is education, it is support for the wider social issues that they face, whether that be training, wider health, education, and employment. So it has to be a broad picture, but I'm afraid I'm the wrong person to ask about the situation on the ground in terms of treatment. That's not my area of expertise.
But just looking at it from your perspective, obviously you're responsible for what you're responsible for, but you must look around your environment and consider that actually a bit more funding in one particular area or a bit more resource in another would make your life a lot easier. Where would you like to see more pressure put?
So I think what is strong within the 10-year drug strategy is the sort of the three-way approach to enforcement, which I'm very pleased to lead, because these people cause untold harm, but on treatment and on education. And I think for those who, at the point of need, at the point of their changeable moment, they need to have access to treatment swiftly, I would say. But I caveat with that, it's a relatively uneducated view. But going back in the day, Charlie and I have worked together many, many years. When I was arresting people and they've been committing offences because of their drug habit, what was needed was the ability to get them into treatment then. And that wasn't always available. I suspect it's not available now, but that would make a difference.
Yeah, that's helpful, thank you. And if we look at reduction of supply, so the figures we have on county lines suggest some of the actions you've been taking have been really effective. So reducing the number of lines down from, I think it's around 1,000 to sort of 600. In a normal market, you would expect when there's that reduction of supply, you would see prices going up. Are you seeing that play out?
So the pricing picture is complex, so I suppose a short answer is no. So prices did increase, wholesale prices. So there's a big difference between wholesale prices and retail prices in the drugs market. Wholesale prices around cocaine have steadily increased, but they certainly increased during the period of lockdown at a wholesale level. They have since then, reduced on a trajectory over the last 6 months to a year. In the cocaine market, we think that's because there was sufficient product within the system during lockdown to manage demand, so prices went up because of the context, but not necessarily because of a lack of availability. But there is now, we would say, an oversupply within the system that is causing prices to fall on a wholesale basis.
Do you see demand rise based on lower prices, or is that demand constant regardless of what people are charging?
It depends on the commodity. So the heroin market is a very stable market. So production, if it goes up, doesn't always lead to greater demand. It's a drug that has a reputation. It's not a clean drug, and it's not easy for dealers and networks to create new demand for something like heroin. Slightly different in the cocaine market, where there are people will use it in part as a party drug, and it has a different reputation, sadly, and so it can be easier to create new demand at that point. So it does very much depend on the commodity.
I think demand as well has been resilient to price. It is the opportunity to take drugs that we saw impacted significantly by the COVID lockdown. Fewer parties, fewer get-togethers led to a decrease in the amount of drugs taken by those that we've referred to previously in some of the other areas of our society, but relatively resistant to price demand.
Thank you. And final question for me. We've heard in the previous sessions we've had a lot around the potential for decriminalisation and regulation. What's your view on what the potential impact on law enforcement might be of moving to decriminalisation, let's say of cannabis, to use an example? Does that make your life easier? Does it make it harder? Does it just push challenges elsewhere?
I think it still leaves lots of challenges. So I'm very conscious. I'm a law enforcement professional. I'm not a policy official. It's not for me to change the law. But regardless of whether something is legalised or decriminalised, there would continue to be a criminal market. To undercut a regulated market, to have a differentiated product. And so my challenges with the National Crime Agency, I think, would persist. There would still be a lot of money to be made. There would still be an incentive for gangs to engage in importation and trafficking. There would still be the violence that goes on between gangs competing for markets, and there would still be use of a product that was not regulated, that was undercut in terms of price and quality. So I'm not persuaded that my life would be much easier.
And I'm assuming, Mr. Double, you'd take that same view.
Yeah, I think we didn't see any abatement in the market during COVID. I think in terms of criminalisation or not, I would draw the parallel with sort of alcohol or tobacco, essentially that it is regulated to a degree, but there is still an illicit market there. I think here, the money that is made would be made regardless of whether or not it was a legal commodity or not. They would just find another way to exploit that market.
Do you have any insight? So countries where they've done this, or states in America, wherever where they have moved to regulation or decriminalisation, do you have international comparators for how that's affected them?
Data, I think, is difficult to come by, which is comparative to the United Kingdom. there is emerging information, evidence to suggest that the link with cannabis and mental health problems and psychosis later in life. And so whilst the data at the moment might be heartening in some of the states in the US, countries like Portugal, in terms of the impact, I don't think we're in a position to assess properly the impact of those changes in the legislation for many years to come, perhaps generational. And so I wouldn't jump to any conclusions now about the success or otherwise of decriminalisation stroke legalisation.
Thank you. Thank you very much.
Could I just ask about the national